was that the residents couldn't understand why they were in their own room and they were left there. They felt left there. Why is nobody coming to see me? Frightened. Some you've thought, is it a punishment? Where is everybody? Why have you done this to me?
I don't understand any guideline that keeps a family member out from a dying parent. We're going in to see our dying relative. Why keep them out?
There's a difference in what staff were wearing. And she said to me on my nightly phone call, "Is this it?" And that's the most awful conversation I've had to have. So, as I said, for 10 months, even as she lay dying, I could have no physical contact with her.
Do you agree that those groups and others like them should have been better listened to by decision makers during the pandemic?
So I think, as you just allude to in that question, one of the challenges is that there was just limited groups in existence representing particular rights of residents emerged, if I recall right, during the pandemic and became a very effective advocate on visiting. There wasn't such a strong voice from residents of care homes, is my recollection.
Peroni stood by their decision to stop the routine inspections and you agreed, but it was still likely to uncover bad cases in the next few weeks. Did you, in this meeting, get any sense of the scale of the problem, about how many cases there were going to be unveiled that had been potentially either neglectful or abusive?
No.
Staff working in care homes told us that in-person GP visits were very infrequent. And look there, just two quotes. Our GP, I did a lot of video calls with them. It was hard to get them to come out. And the next quote, as soon as the COVID hit and we went into lockdown, we really struggled to get any doctors, or it's mostly the doctors that would not come into the care home. They quickly started giving instructions over the phone and giving us more and more responsibilities in terms of how we needed to manage the residents.
And it's right, isn't it, that in fact at 11:30 p.m. that day, he was very unwell with low oxygen sats, and the manager called 999.
Yes.
They told him to call 111.
Mm-hmm. They did. Sorry, not. Mm-hmm. Yes.
And do you remember what the doctor said?
The doctor said we don't take COVID-positive residents to hospital. Order the end-of-life pack.
Down, you explained that paramedics do not want to admit from care homes.
No.
Any of those showing COVID-19 symptoms. Was that your experience in terms of your patients within the home?
Yeah.
At that point, they were left with no oxygen relief or any further treatment.
This lady's deteriorating overnight. She's very poorly. I need some oxygen. We've picked up the antibiotics. I need the oxygen. I need it ASAP because our oxygen levels are dropping down. And she prescribed end-of-life drugs. And we never, ever got the oxygen.
But one topic that we wish to ask you questions about is the issue of DNA CPRs and the availability of medical treatment. And the reason we ask you about it is because Eddie Lynch, who you know is the Commissioner for Older People, notes that early in the pandemic he was receiving concerns about blanket decisions being made about the treatment and care options available to older and vulnerable people. And of particular concern, he was receiving reports about older people feeling pressurised into signing DNA CPRs. And to be clear, that was coming also from some care home managers.
Please ask you about DNA CPR decisions, please. You received a letter from Sarah's GP surgery asking to confirm your preferences. This is the first letter you received. How did you feel when you received that letter?
Well, I was incandescent. As I said, I'd come across in the NHS before this tacit attitude that resources were wasted on her. For instance, they wouldn't pin her collarbone when she broke it. And I just thought this is yet another example of the NHS seeing her as a second-class citizen. And although she has human rights under the Human Rights Act, these are being disregarded, really. And, you know, she was a healthy young woman in her 20s, apart from the epilepsy. And at that time, she was in better health than the rest of us. And I didn't see why I should agree to a DNA CPR for a healthy young woman in her 20s.
And I had some questions about DNA CPR. In early 2020, there were reports, including in the media, of DNA CPR notices being misused and concerns about their blanket use. And Dr McCaskill, who's been mentioned quite a lot already this morning, says Scottish Care received reports from care home members that they'd been sent packs of blank DNA CPR forms without any previous discussion having taken place. Inclusion Scotland heard accounts of DNA CPR notices being placed on the records of disabled people and care users without notice or consent. So my question is, what steps did the Care Inspectorate take to investigate those publicly available concerns and reports that DNA CPR notices were being misused and had been inappropriately applied to disabled people and to care recipients?
We were not aware and never aware of any blanket policy of the kind you described.
For people with dementia may have not much understanding of who they are, where they are, but retain a strong, affectionate bond with the people closest to them. Support for that group was terrible, and I think in some cases led to people deteriorating very quickly, dying faster than would otherwise have been the case.
Antipsychotic medications, unfortunately, have been proven over the last 2 decades to have some really important negative effects in a lot of groups, but positive effects. In people with dementia, it's been shown to have even more of a negative effect than you expect. So there is an excess mortality associated with antipsychotic medications being taken if you have people with dementia. And that's of the order of a 1 to 2% increase in mortality. And so the level of prescribing of these medications increased, and that again will have contributed to the increased mortality seen in people with dementia.
Arguments going pulled in both directions, and I understand from the point of view of a care home themselves, you know, they've literally got families on the one hand saying, please stop visiting, it's not safe. On the other hand saying, let us in to visit our family. So those are difficult.
There was 48.9% of care homes reporting an outbreak.
Yeah.
Were you aware of this data at the time you said in the press conference that there was the protective ring?
Of course I was aware of it. Of course I was aware of it. I was the it's very strange, this questioning. I was the Secretary of State.
Profound failure, perhaps the greatest governmental policy failure of modern times. And then he continued with this. This failure resulted in the unnecessary deaths of tens of thousands of British citizens, including a generational slaughter within care homes, many of those victims dying horrible deaths, often without the solace of their loved ones. Understanding the true causes of this failure is, I believe, owed to the victims, their families, to history and to the future.
Welcome everyone, thanks for being here at the Together discussion on the UK COVID inquiry care sector module, what was covered and what was covered up. But I want to welcome you all to this evening's discussion and on Rumble. Rumble are far more robust for free speech than YouTube and some others. And just to say, we've seen a lot of terrible things happening just in a few days of the Online Safety Act on many of the platforms. And even prior to that, and we need to keep fighting for free speech so we can keep discussing very, very important things like this, particularly around the COVID inquiry, which doesn't even want to discuss lockdowns in and of themselves. But this evening we've got a great panel, so I'm happy to introduce some of them. I'm only going to give you very short bios. You can see more about them on our site and elsewhere. I'll be chairing this evening, but we're going to be having Kath Blythe, who was running 2 care homes during COVID, Leandra Ashton of the People's Care Watchdog on the impact of visiting restrictions and their submission of evidence to the UK COVID inquiry, We've got Amanda Hunter, who many of you know is the chair of the Together Health and Social Care, on impact on dementia residents, end-of-life protocol abuses, and her contribution to the People's Care Watchdog submission to the COVID inquiry. We've got George Fielding, disability rights activist, on the impact of the disabled, do not attempt resuscitation, DNAR notices, and access to treatment. And Eileen Chubb from Compassion in Care to speak about whistleblowing from a care worker's perspective. So, what we'll do is we'll get some introductory remarks from our speakers. We've got quite a lot of people on here this evening, and what we'll ask you to do once we have everyone speak, if you put your hand up, then we'll be able to come to you for some questions and points. We're all grown up and robust, so we can handle what we hear, but I would ask you not to heckle or talk over people. Everyone will get a chance to say, you can say exactly what you want. We're not going to censor you, but I would ask that we do it in a civil way, and that way we can really interrogate ideas, however terrifying they may be to some people. Right, so without further ado, why don't we start with Kath Blythe, please?
You're on mute. Thank you. I think I managed that. Hello, everybody. I doubt you're going to have time to discuss all the issues that I could volley at you. Being a care provider of 2 care homes, Blackpool having 20 residents and the Blackburn care home having 16. God knows how the people with 80 and 100 residents managed throughout this period. God only knows. But I'm just going to run through a couple of points that were extremely challenging at the time throughout COVID, apart from the cost of the masks at the time, which were £50 a box, the 50 masks in each box. We were going through the process of about 20 boxes a day to keep up with the guidelines, and having to remove one every time you've dealt with one individual. And then going on to the DNA CPRs, which I flatly refused to do, and basically stated that, everybody has a right and a choice. And if they say they want to be resuscitated, by God, you will, or I'll be on every radio station going. So I was considered a difficult care provider to deal with. We had the problem with some of our ladies could lip read, and that was their only way of communication. So having a mask covering your lips was virtually impossible, and excluded them totally from the day-to-day carryings on in a care home. The bullying that went on with district nurses forcing the residents to have vaccines. In Blackpool alone, I had one couple, a married couple, who flatly refused to have the vaccine, and these 2 particular district nurses would come in every single day to badger them and go through, you're, apart from one, you're the only others that haven't had the vaccine in this care home, to the point where they asked if there was a double room vacancy in my Blackburn care home. And I said, well, currently, yes, there is a ground floor room that would be perfect for you and your husband. And she said, well, we'll go over for 2 or 3 weeks. She said, because I feel like I'm having my head pecked constantly by these nurses. And as it turned out, we took them over and we got a visit by the police. These 2 district nurses had called the police and basically stated that they felt that they were there was a safeguarding issue, and they had a duty of care to make sure that these 2 people were okay. But by the time the police had got there, those 2 weeks had transpired and they'd gone back to Blackpool. So they came knocking on the Blackpool door, and being a broad Yorkshire lass, we said, the police are here and they would like to interview you. And she told them where to get off, basically, in no uncertain terms. And she said there was no need at all for the constant harassment. And we were told that we were aiding and abetting this couple. And I said, aiding, abetting what exactly? I said, they have a choice. I said, they have full capacity. If they don't want the vaccine, they don't have to have it. I said, so all I can see here, and all the team can see, is that you are trying to harass them into having the vaccine. But what we weren't aware of was while they were in the Blackburn care home, they kind of got on very well with the district nurse in the area. And, you know, she had a chat with them and she told them of all the benefits. And even though she knew of their problems with their health, she managed to get them to have the vaccine. Well, all well and good, but within a 4-month period, they were both dead, which was not all well and good. And the only other person that they didn't badger happened to be an ex-nurse. And her statement was it hadn't gone through the gold standard. So there was no way she was going to have anything put in her body that had not been assessed properly. So it was just one thing after another with them. And it got to the point where we never had COVID at all in either one of the branches, right until the very end of COVID, where a district nurse walked through the door and she came to give the vaccine to 4 of the residents who needed, give the insulin, should I say, to 4 of them who were diabetics. And at that time, it didn't matter if they were any kind of an advocate. They could be the fire brigade, they could be the police, district nurses. It didn't really matter. They didn't have to show that they didn't have COVID. Well, after this particular time, she came through and within 4 weeks, 3 of them were dead. And then we found out through the grapevine, because I know 1 or 2 of the DNs there myself personally, and it was her that had been in the care home that had passed the COVID on. And I then got onto the hospital because I was on the safeguarding committee in Blackpool and I was also vice chair for the care providers. I then said, this is outrageous. This should never have happened. I said, at the end of the day, yeah, I agree. At the end of the day, I said they should also be showing that they haven't had, you know, they've tested and they are negative. So then that was introduced across the board. Prior to that, you know, they could walk through the door and have carte blanche to just do, you know, whatever they felt down. The one thing that I don't think anyone has ever kind of addressed is the fact that staff, it doesn't matter. If you do something now, you can get a safeguarding put against you. There was all sorts of stuff that went on in the COVID period. Lock-ins. Staff couldn't go home. You had to stay in the home because you would get it. You'd find the next day that certain ones wouldn't come on duty. And they'd say, oh, I've got a test, and it would be a false test, you know, because sometimes we knew that if you put Coca-Cola on it, it would prove positive, you know, and some of the girls would mess around and say, oh, look, this has turned it positive, or that's turned it positive. So if they don't want to come into work on the weekends, usually the weekends, then they would just hold up their little note and go, look, it shows it's positive. So, and there was a couple of times where I did 48-hour shifts. Well, I'm nearly 70. So at the end of the day, I'm retiring. My time is done in care homes. I didn't sign up to kill off the elderly, and basically that's what's happening. I don't want any more to do with it. So for me, I'm retiring, and it is as simple as that. But I know I'd go and take a meditation hour just to keep me going, because it was virtually impossible. And I would have ended up doing a 60-hour shift if one of the girls decided that, you know what, you've done enough. I'll stay that extra 12 hours. You know, you would have maybe 5 or 6 staff on duty with you for 20 residents. You only have to get 2 that didn't turn up. And now, of course, you only have to have 1 that's missing, and it's a huge safeguarding. That would never have turned up in the COVID time. You could have ended up with 3 staff on duty. How the hell would they know? They never walked through the door. And the lady was quite right. No doctors turned up at all. You could say, you know, send an ambulance. That wasn't going on either. You know, we didn't get any ambulances that came out. We got no doctors that came out. The only people that actually came through the door were district nurses. And sadly in Blackpool, you know, we had some really good district nurses there, but we had 2 that were bullies. And as far as the Blackburn branch went on, that was down to my one of my managers. And it was a similar issue. We never once stopped any family member from coming in throughout the whole COVID period. If they proved that they didn't have COVID and they gave a test, they'd stand at the door, take one. If it showed negative, we brought them in. They were in a special room with their family member, and they proved negative as well. They could hug, you know, they could do whatever. We never took that right away from them. I think that was the most appalling decision. Whoever the hell made that, clearly had no, for me, no feelings for their own family members that were of a similar value to these people that we're saying it's okay to go and wave at them through a window. If that was my own parents, I'm sorry, the window would have been put through. I was not going to stop anybody from seeing their family members. I would put myself in the same position as them. So that wouldn't have been fair. And like I said, we never got COVID in either Blackpool or Blackburn until the very end. And it was a staff member that took it into the Blackburn branch when we were coming towards the end of COVID, sadly. But prior to that, with all the contradictory policies and procedures that we were being given constantly, you didn't know whether you were coming or going half the time, whether you were going to be done with a safeguarding, whether you were going to have your license taken off you. And it was one threat after another after another. I'm going through a similar thing in Blackburn with Darwin at the moment. I've managed to sell my Blackpool care home, thank God. And I'm hoping that that's going to be the next process for me. But I can tell you, there's so much more I can tell you that will actually blow your mind. You wouldn't believe half, all of which I have documented evidence to prove, and in some cases, video evidence. And some of that's absolutely eye-opening.
Thank you, Kath.
Yeah.
All right, we look forward to hearing more. And now I'd like to ask Leandra Ashton of the People's Care Watchdog to speak. Thank you, Leandra.
Thanks, Alan, and thanks so much, Amanda and Together for making this happen. It does just feel so important to mark the end of the inquiry with this online event. So the People's Care Watchdog, we sprung up spontaneously in 2021 when a video of my mum's arrest for taking my grandmother out of a care home went viral. And the number of messages that we received on social media showed me that we were not alone in this situation, that there were thousands upon thousands, perhaps we'll never know the full extent, of people that were in a similar situation to us. So really, I was just one of thousands of people that were watching their loved one deteriorate behind closed doors, locked windows, with this relentless, senseless message that this was to protect them, that this was for their safety. Meanwhile, we were witnessing the most horrendous dehydration, malnutrition, all manner of psychological and physical deterioration. So from these messages that we received, we set up the People's Care Watchdog. We started as a peer-to-peer support group. We still operate as that. But pretty rapidly, we became a campaign. The stories that we were being given were so horrendous that we contacted lawyers, Hodge, Jones and Allen. They were as horrified as we were, and with their help, they have worked with us pro bono since 2021, January 2021. So all of us within the support group, we all took, and anyone who had a loved one in a care home, we had very, very steep, rapid learning curve when it came to human rights, when it came to legislation that was supposed to be in place to protect our loved ones, but in actual fact, in many cases was being used against them. Things like DOLS, deprivation of liberty order. So from this body of evidence with our lawyers, they felt it was absolutely required for us to apply to the COVID-19 inquiry. I wasn't expecting great things from the COVID-19 inquiry, but I have to say, having followed and seen some of the evidence that's been submitted, there are some really important things that have been said and that have been put down on record. Now, for us, despite the fact that we had first-hand experience and thousands of families that we were in touch with had first-hand experience of what was happening in care homes or to vulnerable people, whether they were elderly or had disabilities. We were rejected 3 times from the COVID-19 inquiry, but they did ask us to submit a witness statement. So this witness statement took us over 6 months to write. And to say that it was re-traumatizing is an understatement. Myself and a very small core group of volunteers, Amanda being one of them, gathered together to write down, to answer some of the questions that the inquiry gave us, including things about do not attempt CPR, the blanket nature of those, the effect of restrictions of visiting. So we not only gave our own personal experiences of these, but also as a collective, as a group. There were moments, quite honestly, when I was writing this, and I know others had similar experience, when all I could do was sob. That is the extent of the trauma that people experienced during that period of lockdowns and the impact that it is continuing to have on families today. Now, we wrote up, as well as our core group of founding members, our own case studies. We wrote up over 20 case studies for families who experienced unlawful end-of-life protocols. And while do not attempt resuscitation has been covered in the COVID-19 inquiry, and the blanket nature of this and the misuse of medication, all these things are great to see. But it does feel, and I know this is something that Amanda and I have spoken about, it feels like we need to join the dots together, that there is a very disturbing tendency within care and within the NHS to place people on unlawful end-of-life protocols. So the only thing that really got us through, listening to all these stories again, writing all this evidence down, was the concept that the light at the end of the tunnel was that this information would become part of a public record, that it would become a historical document, and these families that, and I know many of them are on the call tonight, that their suffering would not be in vain, that something good would come from these horrendous experiences. Now, rather disappointingly, we're still waiting for our information to be published. And while the inquiry is still within their rights to wait to publish it, it does feel disappointing and concerning that it hasn't been published during the hearings. Also, it just feels, where is the press coverage of these hearings? Where is the re-examining of this information? So my biggest hope is that this information, it's not actually a hope, it's an absolute commitment, that this information that we have given, it will not be buried. It will not be buried under mountains of bureaucracy, that the family stories and the experiences of ordinary people, it will see the light of day. Whatever it is we have to do. Personally, I feel we need some sort of similar experience to what happened with the Horizon scandal, a huge, very impactful documentary or drama, so that the public at large understand what took place in care homes and hospitals during lockdowns, because they are still in the dark. But I believe that if we do that, if we bring this to light, there will be such a huge public outcry that all the neglect and all the abuse that is currently taking place, continuing to take place in care homes, and often huge discrimination also in hospitals against those with learning disabilities and those who are older. I believe that there'll be such a public outcry that we will create new systems of care, such as social enterprise care homes, community-led care homes, where the people are placed before the profit. And these big organisations that very much, unlike Kath's smaller care homes in Blackburn and Blackpool, a lot of our care homes are being run by huge organisations that take their profits offshore. So that's my hope, that it clearly hasn't happened so far during the COVID-19 inquiry hearings of the care home module. But I know that there are enough families and there are enough of us that are absolutely determined that this information will come to light, and it will. And when it does, there is going to be such change.
Leandra, thank you very much. Some really useful points to come back on in the discussion there. Now, can I ask George Fielding to share with us, please? Thank you.
Hi, everybody. So fantastic to follow everybody else. The first thing I want to say is that when the state asks for obedience, justice dies in silence. I delivered care. I helped co-found two care providers during COVID, and they were in residential care and supported living. And may I say that bed capacity came before any other form of capacity. The Mental Capacity Act was just simply forgotten about, because the basic tenet of the Mental Capacity Act is that you are not allowed to assume that someone doesn't have capacity, and indeed, secondly, that any resident patient has the capacity to make unwise decisions. No man is an island, but everywhere in chains. Now, therefore, the patients, the people we are delivering to, have the choice to make the decisions they wish to make. And our role as care providers is to facilitate that, facilitate the hugs, facilitate the experiences, facilitate the activities, and give life back to people and enable them to have life. There was no life in any of the care homes that I saw and that I walked into during COVID. We stripped away anything that could have brought value and love and justice to the people we were caring for. Now, this is having incredible consequences. COVID enabled two things: the greatest centralization of power that we've seen in generations. Blanket orders, you do this, and in doing so, it saw a prevalence of the most Victorian attitudes for people with disabilities that I think we've ever known. So you were all ranked on what condition you had, or whether you were medically vulnerable. Your body and whether it worked or not, and how it worked, is the only thing that supposedly was of value to you. And as a result, our lives, disabled people's lives, were at the bottom, which is actually where the state has always wanted people with disabilities to be, because actually they do not have a solution to how we reinvent the services that the people with disabilities need, like speech and language therapy, physiotherapy, social care, children's services. All of these things we've never seen a strategy for, and we've never really given the resource to people in communities to redesign these services. The state knows it has been complicit in the disabling of people by not giving them choice and by breaking the system. And as a result, COVID was incredibly convenient for those that have power, the very few that have power, because it enabled them, under the guise of safety, to hide and mask what a broken system and what a broken society we have, okay? Social care has never been social nor caring. But in COVID, we couldn't prove that because no regulators came in, no family came in, whistleblowing went out of the window. So, and people that I cared for and loved, and I don't mind saying I love, had no recourse to respond. If you have dementia, if you have a learning disability, for instance, all of these things make communication more difficult. Imagine how difficult communication is when you've got a mask in front of your face and you're living in a society and in an environment, and you're locked into an environment that you don't understand. Now, MenCap, not the greatest organisation, but MenCap have a really powerful statistic. One in 5 people with learning disabilities that have a DNR had that DNR placed upon them during the first year of COVID. Not a surprise. And I know I'm speaking to the converted, but what did do not resuscitate orders mean? It means that if you get to a certain point in your condition, in your recovery, we're not going to bother. You are easier for us to dispose of. Your life is not worth living, and should a family member, your friend, or anybody protest, we will say, well, they were disabled anyway. And I'm sorry, but this attitude is exactly what we see now with assisted suicide. Assisted suicide is just all of the same rubbish and wreckage we saw during COVID that they can't solve now with the language of rights, autonomy and control and individual liberty. Individual liberty. Well, if you've lived through COVID and you've never experienced pain in your life, and you know how broken our society is, you don't want to live as a disabled person. And so, of course, being able to choose the point at which you die is a privilege, and something that you want, but it's not a good death. It's not a good death. It's just cost efficient, and what it is morphine and a cocktail of drugs. The same drugs are used on death row and other things to kill you. This is not like taking a tablet, but woven in all together, we have a narrative now that disability is confusing, complicated, and you don't want to live our lives. But more importantly, if I may say so, disability has become harder to define and harder to advocate for now, because everybody rightfully is traumatized by COVID, has anxiety, has mental health conditions, and has all of these things, because we were all living lockdown lives and living lives that we weren't meant to live. Now, a lot of the conditions that you now call disabilities should be treated elsewhere and treated quicker. They're not long-term illnesses. But those systems and services that were there for you before haven't returned, because the state wanted you to do, and the NHS and social care to do one thing, which was to be a mono-purpose entity and get rid of COVID. But even if you could say it got rid of COVID, it got rid of choice, autonomy, rights, and dignities for the most important people in our society, and the people that most need to be heard, and those that most know why this society and our democracy needs to change, because it got rid of the platform for people with disabilities to speak, which is why it is incredibly crucial that we're here today, and we ask again for more, and we do dissent. Because the one hope I have is that I know if we got another pandemic, that our society, our community wouldn't be able to lock down again. So God knows what the state will do next time. But I hope they won't do the same again, because we will tell the stories of those that have suffered and those that we've forgotten and those that died unnecessarily. And to all of those families that are fighting to get their voice heard, I thank you. And I stand by you, and we'll keep fighting.
Thank you, George. And it's very powerful. And as people have been commenting in comments, there is another round of pandemic preparedness, they're calling it. Well, we jettisoned the pandemic preparedness strategy last time and implemented lockdowns and all the things that discussed, calling it Pegasus. But they didn't much listen to our Perseus report, and they don't want to talk about lockdown. So it will be interesting, as people have noted in the comments. I'm going to ask now that we have Eileen Chubb from Compassion in Care, and then we'll come on to Amanda, and then we'll all get a chance to speak. So Eileen, over to you, please. You just need to take your...
On mute. Okay, hi. We're coming more from a national perspective than from any individual experience. For example, some of the FOIs that we did to the regulator during COVID, they did not want to give us the information on how many people had actually died in residential care homes with no medical intervention whatsoever. And we had to appeal that, and we won the appeal, and half of people who died in care homes died in residential care homes. Another piece of data that we got during COVID was that CQC dealt with 2,500 reports from whistleblowers and responded with just 17 care home inspections. We had nearly 1,000 calls from whistleblowers, and we're a tiny charity with very little resource. A helpful comparison would be after BBC Panorama featured one of our whistleblowers, we took in the space of 3 days 4,671 telephone calls, and we helped every single one of those people and responded to every single one of those concerns, even though we have no salaried staff and are run by volunteers. So obviously the regulator was a complete failure during COVID, as consistent with how they were failure the rest of the time. There are lots of consequences from COVID that are still ongoing. It changed the dynamics in care homes because we lost unprecedented numbers of staff who cared. Staff who spoke out were completely, they didn't want to work in care anymore. They were so demoralised by how people were treated and what they witnessed. I'd always like to read from our whistleblower testimonies. Now, I'll just read 2 quick ones. Quote, there are not enough staff. Lots of people are sick and sometimes we have agency cover, but mainly we don't. I reported how people were not being cared for. There's not enough of us. No one could cope with this. The people we care for can't do anything like pick up a drink. We have to do it for them and we can't get to everyone. One person has not had a drink at all today since 7 this morning. Lots more people like that every day, people calling, help me, help me. I hate myself for having to walk past them. I hate this company for making me do this. I hate them for not listening to us. I love the people I care for, but I've had my shifts cut and I'm on a 0 hours contract. They call it bank staff. I had no choice but to say what was wrong, but I will always feel guilty about that because it meant I had to leave the people behind. One more quote. There are no nurses here. We have no PPE, and the only advice is from a GP on a video link. That's not medical care. The people who are really suffering. They can't take a drink. They need to be on a drip. They are so thirsty. They need help to breathe. This is like a war zone in here. They need to be in hospital. I keep reporting this, but I'm told to leave it alone. Yes, people have died from lack of medical care, and I feel so useless that they just won't listen to me. We have hundreds of testimonies like that. The COVID inquiry has not heard the voices of whistleblowers, of which there were hundreds and hundreds of people who came forward and said, this is happening, and we are still seeing the consequences of COVID. One of the hidden consequences was the increase in calls we had about thefts in care homes. One of the most serious themes that have emerged were the sexual assaults that happened in care homes during COVID, because residents that were recognised as high risk of attacking other residents and sexually assaulting them or physically assaulting them are usually allocated one-to-one care. No consideration at all was given to that situation in a pandemic. You had those one-to-one carers being called away, and the people that they were supposed to be monitoring all the time were committing sexual assaults and assaulting other residents, and that the figures on that were massive. We did FOIs to every local authority in the UK. I'll just read a few examples. During 2019, there were 2 sexual assaults in Solihull. During the pandemic, between 2021, there were 25 assaults. Wiltshire, there were 6 assaults in 2019. During the pandemic, there were 90. Wakefield, there were 23 assaults in 2019 compared to 2021 when there were 51. And it goes on and on and on, and the numbers are massive, and an increase of 80%. That's not been dealt with by the COVID inquiry. None of it has been dealt with at all. So, I could go on and on about many different themes, but many care homes changed, the dynamics changed almost overnight. So you had good staff exiting that did not want to go and work in another care home, who wanted to go and work somewhere else because they said they never want to be in that situation again. So you end up with staff that really don't care, so it's okay. They can go and work in care homes. I'm not saying there are good staff out there still, but the sheer numbers of good staff that exited the care system after COVID is a national scandal. And it's also meant that there's been ongoing abuse as a consequence of that. The government during COVID had absolutely no idea how care homes worked, and they treated a care home as if it was a hospital and you could isolate people. 70% of people in care homes had some form of dementia or memory problem. You had people wandering. You had people locked in their rooms against their will and calling, help me, help me. And staff have reported this to us. They've reported it to the authorities and nothing was done. That's how care homes complied with government policy. You can isolate people that have COVID. No, you cannot do that in a care home. There was absolutely no grasp of the situation, and the suffering that we heard about, people gasping for oxygen, that there was, and care staff who felt like they were working in a war zone and there was no medical assistance there whatsoever. And that's absolutely horrific. I mean, care homes are not the perfect place anyway. There's some brilliant ones, there's some awful ones, and there's a lot in between, and there's no way of knowing what's what, because 90% of the calls to our helpline are about care homes rated good or outstanding. So if people are raising concerns about those homes, what can we say about the ratings and about the regulator? And I think there's a lot of fundamental issues here that have not been addressed by the COVID inquiry in any way whatsoever. They're not even on their radar. All our 48 reports were sent to the inquiry, and we've had not a single comment from them in response.
Wow.
Hundreds of staff risk their jobs and to do the right thing. We're just very sorry that the COVID inquiry couldn't do the same thing. Thank you.
Thank you, Eileen. It's not very often, I sit on a lot of panels, but it's not very often I'm blown away by every contribution and made as furious and outraged simultaneously by the comments. There are comments coming in about midazolam and other issues. We know Hancock talked about a ring of steel. It wasn't there. We also know we lost 45,000 care workers because of the mandatory jab that they did not want to take. So that was also a huge blow. It's never been addressed. There is a people's vaccine inquiry that Hart and Claire Craig and Ross Madiman and a number of other people, doctors and paediatricians and others have done. And just to say, Leandra, as well, there's already been a comment about an idea for documentary, and we'll introduce you to Leslie Caton afterwards. But there are lots of people watching and listening to this that are equally furious and outraged simultaneously. So it's not that that's a great space to be in, but it's utterly shocking and terrible. So now I'm going to ask Amanda Hunter to speak. Thank you.
Yeah, thanks, Alan. I think as we've seen and heard in the evidence shared by witnesses, both to the UK COVID inquiry and the testimony shared with the Scottish inquiry hearings, and all the stories we've heard today from the speakers, we can see that COVID lockdown measures, particularly care home and hospital visiting restrictions, had a profound and devastating effect on care home residents, their families, care workers, and the care sector generally. And I just wanted to tell a little story about my own story, because so much that was covered in the COVID inquiry, and Leandra's right, much of it is very powerful and very damning. There are lots of things that are missing though. But before I talk about that, I'm just going to talk about my experience. So as a daughter with a mother in a care home, when COVID lockdown was introduced, I experienced and witnessed firsthand many of the horrors depicted in those video clips. My mum was bedbound, unable to drink and eat unaided, and needed round-the-clock care. And as Eileen said, people just were not getting their drinks. They weren't getting their food. My mother did not have round-the-clock care even prior to COVID lockdown, but when lockdown kicked in, the quality of the care she was receiving plummeted. She deteriorated rapidly, and I fought with social services to take my mother out of the appalling conditions she was suffering for over a year before I was allowed to remove her from the home. In this time, she had shrunk from a size 12 to a size 6. She was skeletal. Leandra's right, the whole situation was deeply traumatizing. However, despite having lasting power of attorney for health and welfare, I was denied the right to bring my own mother home and care for her. And she went into a nursing home nearer to where I lived. Matters became worse. My access was restricted after complaining about poor care. My mother was evicted from the home, but before she could serve her eviction notice, she ended up in hospital, where no visits were allowed and where, after 7 days of her admission, the hospital put her on end of life. I contested the prognosis, and what ensued was a 7-day battle in the courts to get my mother discharged to my care. I won the battle, and my mother lived another 14 months. Many, many families would not have been so fortunate. I tell you this story as an illustration of the seismic power shift that took place during lockdown between care providers and those receiving care, and between care home residents and the state. Even the right to a family life, supposedly enshrined under the Human Rights Act, was usurped from those living in care. All their freedoms were taken away. They were locked up and their families locked out. Visits, if you can call them that, where they did occur, were mostly through windows or through perspex screens, with the visitor donned from head to toe in wholly ineffectual PPE, which was deeply distressing, as others have mentioned, such as, George talking about this, was deeply distressful for the care home residents, many of whom suffered cognitive decline, and that's about 70 to 80% of the entire adult care home population, and those who are hard of hearing, which my mother was. The idiocy of the pantomime PPE was not lost on families, especially given the dire lack of basic hygiene we witnessed in many of the care homes, those of us who were able to get in, which I was once a week, for an hour. The idea that family members posed a greater risk than care workers or maintenance staff who were often working across multiple sites was just ludicrous. And like most of the guidance, it made little rational sense. And this leads me to the crux of my argument. None of it made sense. And worse, the abject failure of those responsible for drafting and implementing these policies to listen to those raising the alarm about the harm these policies were inflicting and to change course, change direction, led to tens of thousands of unnecessary deaths. As the Department of Health and Social Care senior civil servant Alistair Donaldson, who was referred to in the video introduction, told the inquiry, Whitehall and policymakers should not shy away from the fact that they presided over something that was more than a natural disaster, inevitably exacerbated in places by a few incompetent or reckless errors. Rather, the government public health response to COVID involved a series of catastrophic policy errors and an overall system performance that was, with notable exceptions, a profound failure, perhaps the greatest governmental failure of modern times. And I totally agree. The vast majority of those who died, who lost their lives in care homes during the COVID period, did not die from a pathogen. They died as a direct result of government policy. It is estimated that between March 2020 and July 2022, approximately 280,000 to 290,000 people died in UK care homes. And of that number, only 17 to 19% died from COVID. So that remaining 81 to 83% died of other causes. Yes, some from the conditions of old age, some from deteriorating chronic conditions, but many, many died as a direct or indirect consequence of ill-conceived policy decisions taken by the UK government and its institutions in response to a perceived health threat posed by COVID-19. These fateful decisions saw tens of thousands of care home residents abandoned to their fate by a government seemingly more concerned about protecting the NHS than protecting those it was tasked to care for. And, you know, Eileen talked about the 50% of those who died in care who did not have access to medical care. And this is one of the major policy mistakes made by the government. And I'm just going to go talk to about three of the really major policy mistakes during the period. So the first one is the decision to deny medical access and to go to remote medicine. General practice in the UK transformed almost overnight in March 2020. On March the 5th, NHS England contacted NGP practices across the country to advise them to stop taking bookings for face-to-face appointments and to switch to a triage-only system for remote consultations over telephone or video. By early April, most practices had shut their doors. There is absolutely no doubt that the decision to withdraw patient access to in-person medical consultations directly contributed to the deteriorating health and, in many instances, premature death of many care home residents over the period. These decisions prevented care home residents from receiving prompt attention and timely treatment. When my mother was in her care home and I eventually got access, I was told that there would be no ambulances to hospital, there would be no respiratory assistance, and doctors were not coming in. The multiple risks to which residents were exposed were severely compounded by the imposition of family visiting restrictions. With families shut out of care facilities and denied involvement in their relatives' care, this meant that vulnerable residents were left reliant on care staff to pick up on any illness residents were experiencing and triage them for access to remote medical consultation. If you suffer from a cognitive decline, which is, you know, as we've discussed, is about 70 to 80% of the adult care population, you're not able to describe your symptoms. And then you would have to rely on a care worker to relay those. So the majority of care workers were ill-prepared and ill-equipped for the task. Most had no medical or nursing training and often had little, if any, knowledge of residents' medical histories. We have evidence from families and whistleblowers working in the care sector that care home residents and hospital patients were routinely denied antibiotics and other beneficial treatments during the COVID era, and that this led to deteriorating health and residents being placed on end-of-life pathways. And that brings me to the other policy that I'd like to look at, two policies. One was the denial of antibiotics during COVID. So in April, in March, doctors were basically told not to prescribe antibiotics. It was assumed that those who had symptoms were suffering from COVID and not from other infections, which is ridiculous in a care home environment where many residents suffer from respiratory illness and often bacterial infection. So such was the fear and focus on COVID that many non-COVID derived respiratory infections were routinely overlooked, particularly in care settings. There was a tendency on the part of care home staff and absent GPs to automatically assume that those presenting with the respiratory symptoms were COVID cases. And this now brings me to, and there was actually a policy, a guideline issued by NICE, which stated, as COVID-19 becomes more prevalent in the community, patients presenting with pneumonia symptoms are more likely to have a COVID-19 viral pneumonia than a community-acquired bacterial pneumonia. And thus antibiotic prescriptions should be offered only where bacterial infections were suspected. Whereas doctors were not going in, there was no way they could examine patients. And so they were denying antibiotics. And we know from the evidence shared during some of the clips that we saw that this was routine, antibiotics were being routinely refused and people being sent end-of-life medications instead. And that just brings me very briefly to NG163, and people have talked about midazolam and morphine. Now, this guideline, NICE guideline, was published as a rapid response COVID guideline in April 2020. And our evidence and other evidence coming to light, and we have a dossier of cases of people put on end of life, leads us to believe that NG163 and NG191, which replaced it, were instrumental in the premature deaths of thousands of elderly and disabled care home residents and hospital patients between 2020 and 2022. And while these were ostensibly guidelines to be used to inform treatment decisions, the available evidence suggests that the recommendations provided in each were adopted in a blanket fashion and used prescriptively to the detriment of patients, often resulting in premature death. Now, the guideline was very strongly criticised by physicians at the time, and many actually wrote to the BMJ with their criticism. Their major criticism was the drugs that were used, which were an administration of opioids and benzodiazepines, supposedly to relieve symptoms of respiratory problems and agitation. But why this would have been given to patients who were a drug like that to be given to patients with a respiratory illness, when those drugs, midazolam and morphine, are known to depress breathing, is remarkable. And what is also remarkable, and what the physicians also wrote to the BMJ about, was the dosages that were being recommended. These were not in most guidance. It leaves it to the doctor to decide what dose is required. In this case, it was being prescriptively recommended. And given, people that were carrying out these protocols were not necessarily, and very often were not, palliative care consultants and doctors. And so I think that the COVID inquiry does not do is, as Leandra says, it doesn't draw in the dots. You see, because we can hear about stories of end of life, people being put on end of life, people being denied antibiotics, but we're not told where these policies came from, why they were drafted, why were they drafted so hastily, why were they implemented without any risk assessment. And these are the questions that need to be asked. We need to join the dots. And my evidence, my own evidence, which I contributed to the COVID inquiry under the Every Story Matters initiative, has not been published, and I mention all of these protocols in my submission. I also, as Leandra's mentioned in her report, I contributed to the section on end-of-life protocol abuses, and that again has not been published, as Leandra has explained.
Okay.
That's it. Thank you.
Thank you. So thank you, everyone. So look, there's a lot of panelists and there's a lot of issues there. And I think some of the things that would be useful in the discussion, people have obviously put comments in here, is that we could look at, without being too pragmatic, a bit of a plan of action, some takeaways from here, because a lot of the things that you guys have all said is in terms of not having been listened to, of providing evidence, of things that should not be repeated and done again, all that are really essential. And I think that there's a combination of things. I mean, people sometimes talk about, as they have in the comments, about prosecuting people, but together we're very passionate about the public asserting itself and demanding things and politically making those things happen. We have been involved in judicial reviews with other things, but people can spend a lot of time and effort and money to allow something spurious, really, with a decision of a judge and to be tied up with lawyers. And actually, it can end up pacifying everyone a little bit as well, rather than us galvanizing public support and attention in numerous different ways. So that's not to say there shouldn't be legal actions, but there's a lot of really important evidence and experience on the panel and in the room, I'm sure, as well. So I'm going to see if people would want to speak and ask questions or make points. I'm going to chair it quite hard in the sense that it's already 8:10, and I want everyone to get a chance to speak or say some things. I'm going to take a round of questions or points, but I will jump in and ask you to be fairly brief so everyone gets a chance to do that. And just check. One of the things I think will be useful whilst I'm looking at people's who wants to speak or say something, and if you don't know how to, sometimes it's difficult to get your hand. I know I always trying to find the icon on here. You can actually, I can see some coming in now. Then you can just say, "Can I speak?" when if you really can't find it. And let's have a think about the fact that why it is that in the press there's so little of this has been covered, and what we may want to do about all of that as well, whilst we're getting some contributions. So we've got Linda Keane, firstly, please. Put your hand.
Can I just say, I need to go. I'm using the hotspot on one of my staff members because my internet went down and I really did not want to miss this meeting tonight. But he's due off duty and I need to unplug and let him go home.
All right, well, thank you, Kathy. We really appreciate it.
No worries, and any other time for sure. And I've intrigued, and I agree with pretty much everything that's been said tonight.
And I spoke to Amanda about maybe us doing something video-wise with you, so we'll come back to you. I know you did that video for us, but maybe there's some other ways we could do some things. Thank you very much for your contribution.
All right, thanks, and all the best to everybody. Bye-bye. Bye.
Okay.
How do I come out? How do I come out? Let me find a way out. There you go.
Linda. Did we have Linda here? She seems to have disappeared now. I had Linda Keane. Oh, there we go. Can you take your mute off, please, Linda? Thank you.
Yes, I have. Can you hear me now?
Yes.
Yeah. I'll be as brief as I can. As some of you know, my mother was one of those, and I'll just say she was murdered because I don't even believe she had COVID. Her medical records don't actually suggest.
Sorry, Linda, can you speak up? You're a bit faint.
I don't know whether I can any louder than this.
That's a bit better.
Is it? Okay, I'll just get a bit closer. But I tell you what I wanted just to say quickly. Peter Kyle, who is very much in the news at the moment, he is my MP. And after I discovered that my mother had actually, been put on end of life when she shouldn't have been, I went to see him. And I took her medical records and showed him. And he was fairly non-committal. He just said, "Oh, well, just put your case to the COVID inquiry." I thought, well, that would be a waste of time anyway. But then shortly after that, Andrew Bridgen, who many of you know, the MP, he offered us all, about 40 families, to go to the House of Commons and give testimonies. I don't know how many of you know about that. I was one of those that did. Told my story, and at the same time all the MPs for all those families were invited to the House of Commons to listen to their constituents give evidence. Peter Kyle didn't show up, didn't even reply to the invitation. So afterwards I emailed him and just said, "You didn't reply to the invitation, you didn't show up, why is that?" He replied, and this gives you an idea of the measure of this man. His reply to me was, "I don't like Andrew Bridgen and I don't believe what you said." That was his reply. I still have the email and anybody can see it. Now, this is the guy that is now calling Nigel Farage a paedophile. But anyway, that's completely, and he's doing his online safety act bit. But just to say, if we've got MPs like this, nobody's going to listen to us. And this is the way I feel about this.
Okay, thank you, Linda.
Thank you.
So I'm trying to see hands, and some people may not be put hands up, but if you want to just lift your hand like that so I can see if you want to speak, if you can do that. Cheryl, We've got Cheryl next, please.
Hi. It's been very interesting. It's telling us a lot that we've experienced ourselves. I think we just need, if it happens again, to just say no. I mean, we just have to keep saying no. When my mum-in-law, who was 102, was in a home in April 2020, so they'd only just gone into lockdown, they weren't used to what they were doing and what have you. I was told, I got a phone call to say she was dying. And I said, right, I said, me and the two kids, older kids, we're going to come in, we'll mask up, we'll put gloves on. Not that we ever did that, it was probably the only time we did that. We'll come in the back door, we'll go to Poppy's room, we'll spend an hour with her, we'll leave. And, oh, you can't do that, you can't do that. There's no difference between us coming in and your care workers coming in every day. And I just argued it and I went in. And we did that twice. And we actually saw her the night before she died, because after 102 years on this planet, I was so determined to spend time with her. And that's what we've got to do. We've got to say no. If every doctor didn't use the vaccine, if every doctor, stood up against all these treatments that were being used in care homes, if a doctor turned up to actually sign a death certificate, because when she died at 102, he virtually, from his office, signed a death certificate to say she was dead. The whole thing is wrong, and we need people to stand up. And we just need to keep saying no. If it's a daft thing that they're doing, because the whole thing was illogical and unscientific, the whole thing didn't make sense, we have to say no.
Okay, thank you. I can see Kelly now. Thank you, Cheryl. My things keep moving around. So I had Kelly there with her hand up. Are you there, Kelly?
Yeah, I'm here. Sorry, I just couldn't find the mute button. I just wanted to say, because is it Leander? She's the one that's been helping me out. Absolutely amazing support I've had from her as well over the past couple of years. So both my parents were 68-year-old. I just wanted to share my story, to be fair, just to, get it out there. Both 68-year-old. My dad had suffered cancer in 2020. Mum was COPD. Literally both hardworking, but obviously the disabilities had made them be this way. They both took the vaccines and the booster, but lied to me because I was totally against it all. Unfortunately, my dad ended up with a major bleed to his brain. I was telling the ambulance staff that he was having a stroke, and they said no, he's just confused, he's got a bladder infection. So I was trying my best at the beginning, but no, they told me he'd had a major bleed to his brain. He was left in a coma for 7 days. Mum, who we cared for, she couldn't do anything herself. She was only 68, but we ended up taking over the care because we had care for like a week, and they left my mum on a commode, and she was crying in pain for hours until she could actually get off the commode onto her own knees and actually ring me. So we just said that's enough. Me and my brother just took over the care of my mum. Well, my dad was left in a hospital bed. He come out of the coma within 7 days. They told me he was brain dead. He could move his eyes and he could move his hands. And my dad's wishes he always said to us, all through his life, if I'm ever a vegetable in that bed, you finish me off. He was a grown, strong man. I'm very proud. So as now I've got one in a hospital and one at home, I'm having to run to a hospital and back to my mum every single day. My brother as well, just absolutely ripped our family apart. And there was only me and my brother and my two girls, which my youngest daughter's disabled as well. So obviously, we just went into autopilot, just looking after my parents. My dad was put in a hospital room with no windows and no communication from anywhere. I was only allowed to see him for an hour a day. I sat there playing music to him, just trying to, see if I get any sort of response from him at all. Eventually, I had him moved into another room where he had a window and put loads of photos up of the family to see if that would get him, to see if he could actually who we all are. I had a big consultant come to see me that actually shut the door behind her and actually admitted that my dad had a vaccine injury to his brain, and she'd reported it for me. So we have got that at least. further down the line now, we're on to nearly 6 months of my dad being in this hospital bed. No intervention of rehabilitation or anything, just moving him up and down and trying to move his body for his lymphatic system. That was about it. At this point, Mum was just deteriorating at home. She'd gone from 14 stone down to 5 stone at this point. The care, there was no care at all. So we just did it all. In the end, Mum was rushed into hospital because her heart kept fluctuating. But she was happy enough in herself. She was waving away when she was going in the ambulance to tell me that don't worry, I'm coming back. I just need to get my heart sorted out and get some right medication and I'm coming back. Like, right, okay. But I was terrified because I knew what I knew. But I went home, sorted my kids out, ran straight to hospital with all Mum's bags and everything and a special pillow for her neck and like you do. By the time I got there, they'd already administered some drugs to my mum and her eyes were rolling back in her head and she was foaming at the mouth. Cut long story short, they took me into a room and told me my mum was dying and she'd be dead within the next 48 hours. And I was like, how? You know, she was fine. It was nothing, you know. They said her COPD had got so bad that she was dying. Cut long story short, within 48 hours, they had given midazolam and morphine and finished her off. So then I had to go to the hospital to tell my dad, even though supposedly he's brain dead. My dad now cried his eyes out. He couldn't speak, couldn't, you know, but he cried. So I knew then my dad wasn't brain dead. But exactly 4 weeks to the day, they did exactly the same to my dad. So I lost both parents within 4 weeks of each other at 68-year-old. And yeah, I'm just here living the story and trying to make sense of it all. And everything that everybody said tonight, I've researched, I've looked into it all. And my heart goes out to every single family out there. And we all need to stand together because eventually one day we are going to get justice.
Well, Kelly,
So, yeah.
and it's a heart-wrenching story. And I think that if, with your permission, we might use some of this with everyone, obviously, that's spoken, but maybe...
By all means, you can use it. Yeah, even if you wanted to contact me as well. I mean, I was put forward to yourselves just the other day, actually, by Leander. I didn't know about yourself, so I even subscribed to X as well, just to get on there to join yourselves. So, but I'm only just about to put in for a vaccine injury for my dad because my mind just hasn't been there in the last few years, obviously. But now I've got a hold of it all. But
so on those issues, and I'm going to bring, just if you haven't spoken, I'm going to, any more speaking, we can't have a whole testimony now, unfortunately, but because I'm going to...
No, that's fine. That's fine.
Just saying to us as a group, but we are, so you guys know, there's a few things we're doing it together. We're going to be doing some more stuff on the IHR and the WHO, but also with the Public Health Act, which was actually the thing that was utilized to lock us all down. So whilst everyone is talking about the pandemic preparedness issues around the WHO and the UN, it was actually, and that's why Sajid Javid was so confident to say, don't worry, it doesn't matter what's done at the WHO, we'll retain our sovereignty, because he knew that we used the Public Health Act with the Coronavirus Act to implement the measures that he did. And that is still there and that still needs to be addressed. But more broadly, with some of the jab harms and other things, we've got a number of things going on. Obviously, all these things are enormous. They're major, major issues. And together, we've only got a limited amount of people and resource and everything. Whatever we do, we try and be as diligent as we can. And that's why we want everyone to be a member and a supporter. So I would ask, if you're not, to do that too, because that's how we can keep doing these things and campaigning. But are there any more final points or contributions or questions? They're going to have to be very short now. You can ask questions, you can say something, you can say about what is to be done or anything for the panelists before I bring people in. Just if you can raise your hand, raise it, because
George has a hand, Alan.
Okay, thank you, Rob. Thank you. Well, George, I'm going to get you to come and speak, because I'm going to take you all. So if there's anyone who hasn't spoken, so I will take you, George. You can be the first one back on the responses, if that's okay.
I just simply want to say this. When prisons get to, when care homes get to a certain size, I don't think there's anything really that separates them from prisons, and that's and especially not in times of crisis like we were in. It was you know, they were literally, you know, care homes were full of the people that society didn't care for, didn't know what to do with. I said that before, but really the true crimes were, if I may say so, done by those that didn't regulate the industry properly, didn't and took obedience too far, and there's nothing caring about that. There's nothing caring about farming people away who you can't deal with or don't know how to respond with or want to silence. And that's what the independent living movement, which was the bedrock of the disability rights movement, has always fought for: independence, choice, and freedom, good housing, good care, good social security, and those are the advancements that have literally changed society for people like me, for overnight, and tonight has just kind of proven that with great emotion and great power. But so thank you.
Thank you very much, George. So now we'll go back round to the speakers, and I'm going to be really strict. Unfortunately, I've got to ask you to do 2 minutes, and no one's going to like it, and I'm going to intervene. So I'm just going to ask you to say thoughts and reflections, 2 minutes each. So if we can start, so we've had Georgia, and if we can, right, I've lost myself in it, but I want to see if we can go. Is Cheryl still with us? So we've had Georgia, and if we can, is Cheryl still with us? Not sure. Sorry, is Eileen still with us? Sorry.
Yes, she is.
Yes, Eileen Chubb, can we have you, please?
On mute. Right. Yeah. Regarding change, there will never be change without true accountability, and there just is not that accountability in the system there. I think it needs to be taken back. The political system that we have, they do not represent people, they do not stand up for people's rights, and that's completely wrong. Obviously, we campaign for Edna's Law to protect whistleblowers by putting the victims at the heart of the law, and not the whistleblower, which is currently what happens. But it's always going to come back to accountability. And if people are not held to account, there won't be true change. And nobody that was there during COVID, from Boris Johnson onwards, have been held to account for what they've done. And that's why it won't change until we do something about that. Thanks.
Okay, thank you, Eileen. I'm going to ask you, Leandra. You've said some things about none of the stuff that you've presented having been published or considered, but just in terms of, from your own experience, actionable stuff. I know you said about a documentary and film and continuing, but it seems to me that you've got a lot of evidence, and we can think of some things about how that can be placed. But just from the context of the conversation and all your experiences, just for us to have a think about things that could now potentially be done, as well as anything else, in 2 minutes, which is impossible to do. But anyway.
Let's give it a try. I think change can happen really quickly. I think when there's massive public outcry, change happens because we know politicians are fair weather. So I agree with what you said, Alan. I have no faith in the political system as it stands, and I think the legal system just takes too long. But public support and a collective energy, if there was a really sustained strategic campaign to alert the public to what has been going on, and it may be a documentary. I mean, I know a few people in comments mentioned Jackie Devoy's documentaries. I mean, her first one, I haven't seen her latest one. Excellent, definitely worth a watch. I think it needs to be something more, perhaps like a drama, like something that's mainstream. This has to go mainstream, and the only way to go mainstream, I don't know how to go mainstream with this, but it has to be human, and it has to be truthful, and it also has to show that there can be a change. And I think that it's that. And one of the thoughts that I've had with my background as an actress and my training at RADA, one of the signatories to the submission to the inquiry is the ex-registrar at RADA. And what we're wanting to do is maybe approach some of the famous RADA graduates and get them to give voice to some of these testimonies from the whistleblowers, from the families, to just, even if that's just on YouTube, but get famous faces speaking these words so people actually start listening. And then hopefully that will build a bit of momentum. It needs an amazing investigative journalist. It needs an incredibly brave filmmaker. I think that's what it needs, or drama, TV drama maker. I think that's what it needs, and it needs massive public support. And then it can change overnight.
Fantastic. Well, there's some great ideas there, and let's talk some more. And I'll talk to Amanda afterwards, and we'll link you up with Leslie as well. Thank you, Amanda.
Yeah. So the thing that I'm going to say right at the end is about Gloria's law. So we've seen during the hearings, they have talked about what needs to be done moving forwards to protect people visiting rights in care homes. And they have talked about Gloria's law. Now, as some people will know, Together already has a campaign. We ran a campaign against Gloria's law. It has not been brought in, but there is still pressure to bring that law in. And it's dangerous because what it will do, and there is the same in Scotland, which is Anne's law, and Biology Phenom, who provided the clips for our video, is very keen that I should talk about this, is Anne's law and Gloria's law, which will hardwire restrictions for perpetuity. Because when you look at the small print, what it's saying is, if there was another pandemic or health emergency, let's say, we could do it again. They would do it again. That there would be still exceptional circumstances in which people would be denied visits and they would have to shut down. And this is unacceptable. We cannot accept Gloria's law or Anne's law. And I agree, and Leandra and I both agree, that there needs to be legislation, just as there needs to be legislation against the abuse of protocols in hospitals. But, this is not the right law and we must oppose it.
Okay, well, thank you, Amanda. So, look, I know this is only obviously not even just scratching the surface, but it's been remarkable, some of the accounts of what's gone on. And I know that many people on here and those watching on Rumble and beyond, when we're sharing this again subsequently, will have their own first-hand experience throughout lockdowns with relatives and others with what's happened. And it does go to the core of how we are as a society, how we treat people around, how we care for family and the relationship between citizens and the state, of which we've seen some very increasingly worrying things consistently, even about what you can discuss and how you can discuss them. So I want to thank the panel. Thank you very much for your contributions and everyone's hard work. And obviously some of it's absolutely harrowing, but also the testament to the human spirit and a sense in which people will continue and fight, and commitment and perseverance, which is essential, that light that keeps shining in very dire circumstances. And in the end, we are always stronger together, and that we can make our voices heard, and that we are many and that they are few. And even though we can be very isolated and it can feel like there's no one around in our situation, that actually through things like this, and when we get together and when we challenge and protest and rally and campaign and organise and lobby with what we call our 360-degree approach, which is grassroots, but also getting press and doing stuff with MPs and campaigning and petitions and calls to action and letters and emails to MPs and councillors and NHS trusts and Care and Quality Commission and all of that, and just keep going. And the sense that nothing can change and it will always be like this is changing. We only have to look in America at the Trump 2.0 thing, and whether anyone likes Trump or not is not really the issue. We see people like Jay Bhattacharya, now the head of the NIH, from the Great Barrington Declaration, Robert Kennedy Jr. and others. And, this is a far cry from where things were a few years ago. And that does not mean that everything's resolved immediately or even over time. There are major challenges and obstacles, but changes in the air. Lots of changes happening in Britain. We're seeing that every weekend. We're seeing it with families. We're seeing it with people who are being elected. So the time is now for us to, make sure that we can make our voices heard, to assert ourselves, and to keep campaigning and keep making the points clear. So I think what will be really useful after this evening is with Amanda and some of the guys on the panel that we all reflect on this and think about some of the key points that we can then move forward with. And I want to, again, thank you very much. And please do help and support us and get involved with Together. We're always better and stronger together. Thank you very much, everyone.